All right. Well, our motto for 2023 is first class in everything. So welcome to Dr. Greg and Monica's Facebook Live. And as of this year, becoming Dr. Greg and Monica's All Things Health. We are actually, this is not our usual setup, as you can see. We are here in Medellin, Colombia, one of the headquarters of BioXcellerator Mesenchymal Stem Cell Therapies. And with me, we have a very, very special guest, is one of the head sports physicians over here, Alejandro Ramirez. Thank you for being with us to begin with. And for the next half hour, you're going to be demystifying for us, giving us the real specifics when it comes to stem cell therapy. Which, by the way, Dr. Greg is just here, and he received throughout this entire week. And so he's been through that process. So first off, Greg, why exactly are you here?
Oh my goodness, good question. No, I know exactly why I'm here. Because I would consider myself amongst those people who are somewhat broken but highly motivated to not be broken. It's that as a natural doctor, chiropractic and acupuncture, oh my God, hit 32 years. Can you imagine that? Just hit 32 years a couple of days ago. But the backstory is important because some people would ask, look, if you're just trying to be a healthy guy, all that, you're an old geezer, et cetera, but why are you here? Because a lot of it came, the damage I did to my body as a young man is, most of it was in my 20s. The backdrop, martial arts, weight training, sprinting, boxing, and an absolutely god-awful, horrible diet. No nutritional support whatsoever. And that no pain, no gain, you got to make it hurt more. And a lot of that, the pain was like destroying joints, literally just destroying joints. It was terrible, but you did it anyway. But over a period of years, I entered chiropractic school at age 30, learned a much, much, much better way. But it's the natural health, that lifestyle. I would learn, improve. But that kept me going extra 32 years like that. But most of the damage was done as a young man, the reasons I just mentioned. And besides, sadly, we all get older, it seems like, too.
It just happens.
That's what brought me
You can
here.
speak for yourself, and I'm sure Alejandro will say the same thing. You can speak for yourself, but no, that is exactly true.
That's
so
why.
Let me go ahead and get to, thank you so much for being here with us, Dr. Alejandro, not in Allen, Texas, but here in Colombia, and you can come anytime to Texas you want. Let's talk first about what are stem cells and what are these particular stem cells that we are talking about? And if you can explain some of the different kinds.
Yeah, definitely when we are talking with stem cells, mesenchymal stem cells is a particular kind of cells that are the origin of so many tissues in the embryonic development. So these stem cells can become different type of tissues like tendons, like muscles, like bone, maybe adipose tissue, okay, and cartilage. So we all have stem cells, different sources of stem cells in our body. We have in the fatty tissue, we have in the bone marrow. And recently we know, whole world found that we can find the umbilical cord in the Wharton's jelly as a good source of mesenchymal stem cells. So they have a lot of properties. They can become tissue or differentiate in different types of tissue, but the main effect is paracrine effect. Paracrine effect is by releasing some cytokines or molecules that can interact with the environment, that in this case is our bodies, to make some purposes like healing, like restart a process of healing in all the tissues I mentioned.
Is it the Spanish word células de madres?
Células madres.
Células
Well, it
madres.
translates to mother cells, but that's a good way to conceptualize what's happening because from here, many things flow.
That's a great way to put it, definitely. When it comes to, it's, especially in the United States, it's all called stem cell therapy, but I'm very aware of the great differences in what types of applications. In the United States, a lot of people, it's become the buzzword right now, stem cell therapy. So many people offer it. Why did we come to Colombia to undergo stem cells? And that's where BioXcellerator comes in. So I'd like you to explain some of the differentiation.
I'd like to set that up a little bit.
Yeah.
Because in my clinic, everyone knows sort of what it is, But it's most interesting because out of the people, they'll ask my opinion about this, but trying to become a little more educated and sophisticated over the years, what I've seen in my clinic, I'm not so sure it's a better than 1 in 3 result for people. That's not so good. And to me, that's unacceptable. But doctor will explain in a minute why that is, because it's a vast difference between what is stem cell in many places in the United States or with some practitioner or whatever, and what we've just seen down here.
All you.
Okay, there is no big difference from the type of cells. The big difference is in the quantity we apply in our therapies. Why? Because some regulations, some institutions at the States, United States specifically, they do not allow the manipulation and expansion of stem cells. Okay? So the quantity you receive is less than you can receive in other countries around the world. Okay? So the big difference is that you can receive maybe thousands of stem cells at the therapy they promote at the United States, because they can not expand these cells. So what they do is what we know is stromal vascular fractions. They can obtain from the bone marrow or the fatty tissue. They can centrifugate them and separate the cells, the stem cells particularly, and some other components, and they inject in the joints or wherever they want to do the therapy. Right here, we expand the cells. Primarily by research purposes. And then we can apply millions of stem cells. And this is a therapy that is dose-dependent. Dose-dependent means that you cannot maybe have the same success rate or the same results if you receive lesser amounts of stem cells. The higher, the best. Obviously, in a certain range of amounts. Mm-hmm.
So does that, okay, now I'm going to switch just a little bit and come back to that, but let's talk about BioXcellerator. How did it start? Tell me a little bit about the medical staff over here. Tell me a little bit about what you do, the whole company.
Yes, definitely our main purpose is research purpose here, to investigate, to know the lastings of the stem cells in so many therapies we have here. We start definitely with fatty tissue. Right now, we know that definitely the Wharton-Zelli umbilical cord stem cells are more available at certain point of time where you are going to receive the therapy. They do not need an extraction or a lipoaspirate that is so many traumas, or even a bone marrow aspirate that is so traumatic. So the less the trauma, less the pain of the process.
Seminoles, just by the way, it means to take it out of you. Sometimes like take it out of the fat or like drill into your bone. It's like Texas where we live. You know, drilling for oil, you come out with a few stem cells.
Wouldn't that be good if you could do that?
Yes, that's a difference, big difference. So definitely we have a lot of lines of research where right now we're studying about a spinal cord injury, the disc disease on the spine. We're studying from knee osteoarthritis, shoulder issues, some autoimmune disease. So there is a lot of research here we're performing right now with very good results.
So take us through basically the prospecting and the application from the beginning. If somebody hears about this and says, I wonder if these stem cells would be good for me. How do they, and you might be able to add, because you've been through the process now, Greg, in terms of finding out, getting in touch with you guys, because not everybody is a candidate.
It was interesting. This is just more Greg the guy, coming into the process of everything. Very selective. It was interesting, very thorough. There was maybe a couple of them actually, consults ahead of time, screening process, which told me, no, it's not just, we'll take you and you and you and you, we'll flip a coin, got a good chance of getting better. It wasn't like that. It was actually like very carefully screening, kind of an initial one, then a little more in depth, and a big questionnaire. There was several part process to even make sure. Now, most of my things are, all of them, as far as I know, musculoskeletal. It was just joint.
And more joint.
Yeah. And a few tendons in there too. But that was very, very exact. This whole week here, as a matter of fact, has been very scheduled, very regimented, not super fatiguing, anything like that. Just highly precise, and very much appreciate what's happening. And just as a side note, Dr. Alejandro, one thing I know about his touch, excellent massage touch, excellent. Just you can tell, everybody's professional, but not everybody has the touch. That's another thing.
That's very true.
That's the prayer. Thank you.
Okay, so I'd love to hear, when you guys onboard, or do you take just everyone or not, or what is the process?
We must be very selective because stem cells is not for everybody. Definitely, we mostly define what type of disease you have. We prefer inflammatory disease that there is no big indication for surgery, because otherwise it cannot be healed. Okay. So there is no magic formula, definitely. We must take care and be very selective on the patients we are going to treat, not to do mistakes or something, because sometimes we must guarantee a good result for the patient. So it starts definitely with the good selection of our patients and not expose them to unnecessary risks of pinches or something like that.
It's sort of like cheating, but not really cheating. It just means if you select properly, you win 99.9% of the time. It's really that. You select properly, your success rate is astronomical, rather than if you're just like throwing stuff.
I know that you initially, Dr. Greg, found out about BioXcellerator through some other sources, a couple of years ago or so, and started the process of researching and seeing. And then once you went ahead and went through some of the consultations, you were even told it was at least, a 6-month or more waiting list.
Or 5 for me, something like, it was a while, yeah.
Okay. And so go through for me once you arrived here. I mean, is it just a one-day process, or you've been here for about 4 or 5 days now?
We have a week in South America in Medellin, Colombia. And this is a little off topic, but man, this place is great. I won't even mention his name because everybody says don't mention this individual's name. It's very much on the map because of a particular individual that may or may not be featured on Netflix from time to time. But having said, driver on time, took us to a very, very nice hotel. It's a beautiful city. I've never been. Monica grew up in Argentina and so on, and we've seen bits and pieces. But no, just the general vibe of the place has been very good. So having said that, I came to the hotel, very timely, excellent communication from Alejandro, who was our, guide?
Patient concierge.
Concierge. Yes, you have somebody taking care of
So everything, be here, be there, very excellent communication. So initially, a couple of consultations, first day, checking general health to make sure didn't have any diseases and stuff or anything. And that came out clear, thank God. Then the next day started process of the infusions, which are related, not quite the same thing, stem cells, but orthomolecular medicine, other nutraceuticals, et cetera, to make me generally fitter and healthier, and all of that. Following that, had a day of a break, then all the administration yesterday of all the injections at all my aching joints that won't be taking much longer. And then today, we had another infusion of stem cells and other things. But we did have some time to look around and all of that too. So that's the characterization of the week.
So why spacing everything out? Why not, a lot of times in the U.S., when people go and get stem cells, it's an injection here or a little, and they say, it's a full infusion there, which I'm not sure if it's the exact same thing as what you are doing over here. But why space things out? Why give, the lots of, and I want to get into that too, just the pre-conditions in terms of nutrition and exercise, and even here, physiotherapy that went along with it all. It's not just one injection and that's it. So can you explain a little bit more about all that?
Because definitely the origin of the disease is mainly inflammatory. So we need to take care from different points of view, nutrition, habits, the way you behave, the way you think, and we must guarantee that you are going to receive the therapy in the best environment. The environment is your body. So we must take care of all the details to improve your general condition in the search for health.
As a time, I think a good point here, at a time is natural bodybuilding, actually. that it's a pretty, not perfect, it depends on where you're at, but it's a very clean lifestyle to begin with. That, a bit of coffee, off season, on season, but mostly if you want to do well and continue training, especially as you get older, you cannot be full of inflammation in the first place because you'll just hurt too much. So the plan, part of this too, is that the chiropractic, acupuncture, the proper nutrition, exercise anyway, all of that will give the best possible platform for the stem cells to do their work, which means I'm expecting a really good result.
So that's a big thing too. And I think people don't realize that, we live in a society where it's just give me the pill and I'll pay whatever I need to pay, but just give me that damn pill, let me take it and then do all my vices, do everything else, but get results. That doesn't work.
Definitely. Preventive medicine is the future of medicine.
So even with stem cells and everything that they're doing over here, there are months of no caffeination, no alcohol, for example, being able to eat anti-inflammatory, not after the stem cells, but even before you get them. Why is that so important? I know today you were speaking to Dr. Greg about not being able to work out in the gym for 3 months, and you were trying to explain to him, which made perfect sense, although he's like, oh no, I'm not going to be able to be lifting weights. But why was that? Tell us a little bit more about all that.
Yes, because the stem cells, mesenchymal stem cells, have particular properties. One of them is the homing property. They can search in your body where is the inflammation and try to attack that inflammation. We're changing a pattern of inflammation. Chronic inflammation do not allow the tissue to heal properly. Right now, we are trying to change that inflammation to an acute inflammation that allows the tissue to heal, to release the proper quality of collagen. So definitely we must guarantee that environment to the stem cell therapy.
Because it's true. What Monica says, if there's one thing I do, the basic day for me, I wake up like 3:34 in that early crowd at the gym mostly. Don't run as much because the knees hurt too much. But
hopefully they won't soon.
I hate to yield to age at all, but sometimes to a degree. I like what you said, though. Maybe you can't be 100% anymore, but you can hang out in the 90% area and you can still do very well, but have a much better, bigger quality of life. But having said that, then, yeah, because I think about I very much enjoy my physical training. But the point being, if I make myself all sore, if I go in and do whatever I do, not my legs, but but if I work my arms really hard and they're really sore, if I understand correctly, that's where the stem cells will go.
Yes.
So they'll work on that, but they won't fix the thing I need fixed. So what do we do with that? Like always, we adapt. Now it's time, a bit of more cardio, more stretching, breathing exercises, really fine-tune the diet or whatever it is, go sideways and then go forward in a different direction before coming back to the weights. And then if I understood the other day, at that time, we'll still have to be careful not to change the exercises a bit where it doesn't just change the range of motion, maybe the angles a bit, so it no longer is painful and just creates more damage.
Exactly.
Okay.
So let's understand really quick, and then I've got a couple of other questions for you too. But so these are these baby umbilical cord cells that come into the body, and how long do they live for? What exactly then are they doing? But my husband, Dr. Greg, was laughing a little bit earlier and saying, oh yes, well, now I'm part Colombian because I've got Colombian stem cells in me. And Dr. Alejandro said, no, not really. They won't last that long.
Exactly. And something that they do not perform is to mix with your genomics. So definitely they are not part of your body. Definitely the main effect is paracrine. So they release those cytokines and start interacting with your body. But they definitely do not last for too long. They is just maybe few weeks or something like that. So is the lapse of time we must take very, very carefully what we are going to do, not to harm yourself again, to take care of inflammation, okay? And be precautious on the exercise and something like that.
So if you think this is just for those who have had terrible injuries or who are getting older, that's not necessarily the case. I know I'd love you to share with us your story, Dr. Alejandro, because you've had stem cells yourself. You mentioned to me you're a soccer player. I'd love you to share a little bit about that.
Yes, I used to play soccer for many years since I was very young. So I had chondromalacia grade 4 on both of my knees. I used to run ultramarathons. I used to be very active. I'm still very active. And I inject myself stem cell therapy few years ago. So I saw the results. Now I'm playing again soccer with my friends here at the clinic sometimes.
The guys at the back going, heck yeah.
I participate in some tournaments. I'm still not running marathons, or being more precautious, but still riding my bike. I'm being very active.
So age-wise, when is the earliest? How old is the oldest? I'm sure there's still a lot of research being done with this, but what have you seen when it comes even to results, or who you've been able to help in what ways?
Everybody.
Wow.
There is no certain age at what you can receive stem cell therapy. It depends on the injuries you have. Sometimes we now know that definitely is a genetic condition for being more inflamed or less inflamed. So in that condition, as soon as you receive the stem cell therapy, you can stop the progression of the disease or the damage in the case of the knees. So I would prefer to treat the patients when there is a mild osteoarthritis.
Interesting. And then switching over, we've talked a lot about the medical side of stem cells and some of the things that it can do. But there's a whole other application as well, which is cosmetic. Is there not? I've heard of...
I mean, where we live in north side suburb of Dallas, Texas, that's, I think, more important than the joint store.
To each their own. But what can stem cells do? What have you seen from that cosmetic side? And what do you use it for?
Yes, mix it up with baby PRP. They can be used for restoring the skin, restoring the follicles. So definitely there's a lot of stuff that we are searching for, see how they become.
Let me check for that. What other conditions, neurologic or organic, I'm not sure. What are other possibilities for stem cell?
Yes, there is a lack of knowledge for certain neurologic issues, but we are starting from a research for spinal cord injury with very, very good results. Disc disease, some autoimmune disease. Beautiful. In the chronic neuropathic pain, I have seen very good results, even not just derived from maybe medication like fluoroquinolones or something like that, some inflammatory neurologic conditions.
Which autoimmune are you looking at?
Definitely we're searching for a rheumatoid arthritis, MS.
MS as well.
Yeah, with very good results.
It's beautiful. Changing to people. So life-changing.
That's fantastic. Before, we only have a few more minutes left, but let's talk about... Everybody talks about stem cells now, as I was saying, in the United States. And it used to be something that the rich and famous did, or celebrities, because it's an expensive therapy, regardless of where it is, whether in the U.S. or over here. But what I wanted to point out, and I'd like you to address, is when you are spending a lot of money to get well, that's why it's so important to know what you are getting, what type, again, of stem cells you are getting. Mm-hmm. So once again, for those, I'd like to hear a little bit of that differentiation in those that go to the States. And you've seen it many times. You've had people even come to you, yes, I've had stem cell therapy in the U.S., haven't you, Greg? Just saying I've had a knee or I've had a shoulder, but they've had to go back.
Yeah, I think
6 months
Dr.
later
Alejandro,
or a year later. And I know he spoke about it a little bit.
I think a lot of it, please expand, but goes to quantity. But also I've been incredibly impressed by, give me a little certificate, well, not me, but it was the certificate of how everything was done with how many are viable, how many are actually still alive. Not like, okay, I got 2 stem cells out of a fridge that are freeze-dried.
It was several 100 million even, I think. What was it?
I think it was like a 90%, but they threw in 10% extra to make sure that what I get are millions and millions and millions of fresh, viable, jumping about little baby stem cells, yes. Like that.
So
the United States, to my knowledge, from what people have told me, doesn't seem to have the quantity, and possibly from some other things, not quite so much as far as the quality control. These are the things I'm told.
Can you expand any more on that too?
That's true. definitely.
Okay.
Summary, that's true.
Sounds good. Lastly, then, I'd love you to talk just a little bit more about BioXcellerator as a company, being here in Medellin, and just you are cutting edge, and what do you see in the future?
This is the future of medicine, definitely. It's less traumatic than surgery, definitely. The risks are less. We are right now this is a very safe type of therapy. Where there is a big lack of knowledge, definitely, and we're trying to fix that.
Are there any type of side effects at all that you see?
No.
Or that you
Definitely haven't. I have been working with stem cells for about maybe 14 years, and I haven't seen any side effect.
That's great. And it is. And you guys have been here for how long now as part of BioXcellerator itself? Is it
5 years?
5 years and growing?
Yes.
Okay. So parting thoughts, Dr. Greg?
That's been a fantastic. I'm a very curious person too. I think it's been a fascinating experience all the way through. Of course, we'll see the results. But of course, I came here because I tend to sometimes take a while to make up my mind, but it's because I look and look and look and look and look. Something like this, I want to be right, like with a capital R. And judging by the results, to give a shout out to Patrick and Duke back in Dallas who connected me. They deal a lot with high-level football players and so on too. But the results that they were discussing with me, et cetera, outstanding. So that's why I chose BioXcellerator.
So here you have it. Now, for those of you at home, if you have any questions at all, we're going to be posting this on our Facebook Live page. And so any questions either for Dr. Greg, any questions even for Dr. Alejandro, and you will
I will be happy to talk with you or communicate on that level if you want to know about stem cells, generally speaking. Not whatever I know, I'm no expert at that level, but I'm the guinea pig thing and I'm here. So I can tell you all about that. I'd be happy to discuss or anything particular and then put you in correct contact with BioXcellerator too.
Thank you, Dr. Alejandro. Thank you, Dr. Greg. And we will see you next time from here in Medellin, Colombia.
Thank
Yay!
Primera vez.
Very smooth.
Yeah.
Very smooth.
No, but sé que se cortó. Okay. Sos un amor. No tengo uno acá que no había pensado en eso. No sé si tendrás uno extra. Yo te lo pago al USB o lo que sea. Oh, sí.
We transfer, sí.
Sí.
Descargar.
Sí. Y así yo lo puedo descargar en mi computadora, en casa, lo que sea. Perfecto. Fantástico. Yo te doy mi email address. Perfecto. Fantástico. Y así mejor, seguro, hasta con el audio y perfecto.
Claro.
Y así hasta con ese le puedo sacar excerpts, cositas chiquitas. Ustedes saben inglés también, ¿no? Ah, ok. Cuando digo excerpt, ¿qué te digo? Perfecto, no, gracias. Y esto, como dije, no sé si ustedes puedan usar algo también.